everyone. Happy National Social Prescribing Day. I'm here with a very exciting lady. Please introduce yourself.
Well, I'm also here with a very exciting lady. My name's Julia Hotz. I'm an American journalist here to celebrate Social Prescribing Day in the place it all started, London, England.
Absolutely. And Julia's come all this way and has got me a very lovely gift and memorabilia to signpost her new book all about social prescription. Tell us a little bit about what the symbol of this actually means.
I think the symbol of this is the way that we Americans take our medicine in a nice little pill bottle. And we're so used to thinking of pills and medicine as being one type of thing, things we put in our body. But actually, doctors like you and social prescribers all around the world are showing that medicine can actually be the assets in our community, whether it's a gardening group, an art class, whatever it might be that matters to the patient. That is a social prescription. And if you see up close, we've got little people in here. Some versions have trees and art easels, the whole thing.
I absolutely love that. And for me, social prescription is something that I was introduced to quite early on in my medical career at Bristol Medical School. Shout out to Professor Trevor Thompson, who was a mentor to me and the head of primary care there, and created the module Whole Person Care, where as a first year medical student, I was introduced to community interventions that help people's mental and physical health. We had a Qigong instructor come and talk to us how he teaches the elderly to help with their musculoskeletal system and prevent osteoarthritis by strengthening their muscles and joints. We had a prison charity who did gardening with ex-inmates to bring about that increase in social mobility and reduce the stigma there. And I remember as a medical student, I actually did a project all around cooking in the community because nutrition is very important to me. And I went to a cooking class where people in their 50s plus were learning all different dishes to help all sorts of different conditions. And they've been referred to it from Wellspring Practice, which is Trevor Thompson's GP practice in the city of Bristol, which really champions social prescription. And it was such incredible insight.
I love that so much, Allie, not only because it sounds like that form of social prescribing also helped the patients, but there's actually a lot of data that suggests 1 in 5 patients are coming to the GPs in the first place for social reasons.
Right.
By being able to deliver more holistic care, by being able to address what matters to them, you're not only helping the patient, you're also helping to reduce pressure on the NHS, which is actually what a lot of the data on social prescribing shows.
That's incredible. Just a little bit about the mechanism behind social prescription and how it works in the UK, for instance.
Sure. Well, it started in the UK, and it started by these kind of rebel doctors who were seeing in their patients that maybe the problems and the symptoms they were displaying weren't always explained by a biomedical reason. So social prescribing, what it does is it flips the script. Instead of saying, what's the matter with you, it asks what matters to you. And then depending on the patient's answer, many practices now have a position called a link worker. What that link worker does is then spends up to 30 minutes with the patient and gets to understand what sorts of things they're interested in, what are their hobbies, what was their life like before they got sick. The link worker is also like this amazing sort of Google search engine of what's actually happening in the community, and they then link that patient to the thing in the community.
It's honestly incredible, and you just wish that every patient in the country could experience that. What is it looking like in terms of geographical distribution here in the UK with how social prescription's infiltrating GPs?
Totally. It's what I love about the way that social prescribing has spread in the UK is that, first of all, folks have been doing social prescribing by other names years ago. The name social prescribing may be newer, but there's been holistic care, community-centered care, and even though this specific model, where it was first called social prescribing, started at the Bromley by Bow Center in East London, we also have seen really effective models from Dr. Michael Dixon with his practice in Cullompton. Right around the same time, he was prescribing all sorts of community-based supports. And then really in 2018, 2019, there started to be more national mobility. What can the nation learn from these local models of this thing that's organically spreading?
Gosh, that is so exciting. And are there any estimates on a year or a date when every patch of the country will have social prescription services?
That's a great question. Really exciting update from the NHS long-term plan in 2023, which is aiming to have social prescribing embedded in more practices, more link workers. It's also, this is not just a hope, but it's grounded in data that doing this has reduced pressure on the NHS, has reduced those emergency attendances, has saved money actually by investing in social prescribing.
That's epic. And obviously I'm very passionate about healthcare education and starting from the bottom up with medical students. What's the story when it comes to social prescription in medical school curricula?
Absolutely. Well, it's funny we're talking about this today on Social Prescribing Day, because this whole idea of a day was conceptualized by these really passionate medical students who, just like you in your work with NutriTank, realized that there was something missing from their medical school curriculum. They wanted more ways to understand the pathways of how future healthcare professionals like themselves can do social prescribing. And so what the story is there was this amazing student champion scheme led by a wonderful doctor named Bogdan, who now works for the National Academy of Social Prescribing. And what he did was he sort of started this, he calls it the revolution of the peasants. This amazing bottom-up fight to get social prescribing taught in every UK medical school. And now, under that student's, the social prescribing student scheme leadership, he's been successful in that.
Gosh, that is wonderful to hear, these bottom-up movements. And like I mentioned to you earlier, I've known Bogdan since I was a first year medical student. He must have been third year at the time, and it's wonderful to see how much this work has progressed, especially with incredible mentorship by Dr. Michael Dixon and Sir Sam Everington, who started practicing at Bromley by Bow. Shout out to all of them for their incredible work. And so I want to move on to the personal side of things, and really just curious to know, what has been the story that's cropped up in your research around social prescription that's moved you the most?
It's a great question. We have all this wonderful data thanks to the Social Prescribing Network, National Academy of Social Prescribing. What my book aims to do, The Connection Cure, is to tell the stories behind some of this data. So there's so many stories of this having life-changing benefits all around the world. I'll just pick one today. It comes from a woman named Akila in Bolton, up in England, and she had been this amazing caretaker, this amazing mom, dedicated her life to caring. All of a sudden develops this excruciating back pain and is no longer able to work. And in her bout of back pain, she's sitting on the couch, she's not able to work. She finds herself also struggling with depression, right? She's had to give up the thing that she loves most in the world. She tries all these different routes of getting better, all this pain management, talking therapies. Finally, she meets this amazing woman named Joanne Gavin, who is a link worker over at Bolton Community Voluntary Services. And Joanne starts the conversation actually by telling some of her own story, how she too had struggled with back pain. She too had struggled with her mental health. And she's the first one, though, to ask Akila, what matters to you? What would your life be? What was your life like before your pain? What is it that you really want? And Akila says, I want a job. I want to feel useful again. And so what Joanne does, who has this encyclopedic knowledge of all the voluntary services in Bolton community, she prescribes Akila a spot in a charity called the Legans Foundation, where Akila, without taxing her back, was able to still do some of that caring work from her desk. Lo and behold, today, Akila has gone from being a volunteer there to getting an apprenticeship there, so now being a full-time employee there. Her back pain, though she still struggles a little bit, it's so much less a part of her life. She's no longer depressed, and she really credits social prescribing as being the thing that helped her feel like her full self again.
Gosh, that is such a magnificent story, truly. I can see why it's up there, and I'm sure there were many to pick from, but I can see why that one's up there.
And how about for you, Dr. Ali Jaffe? You have done so much work in this space. You've seen the healing powers of connections firsthand and all the organizations you support. What are some of your favorites?
I'd say for me, the people I dedicate most of my time to are the young, and I'm not ageist, but I've just always been very passionate about youth mental health health and hoping within my psychiatrist career to subspecialise within CAMS, Child and Adolescent Mental Health Services. And I'm a trustee for the wonderful grant-giving charity Chimo Trust. It sounds like a random name, but Chimo actually is the word for friend in the Inuit community. And so it just became the name from our wonderful founder. And it was also his childhood nickname. Gavin, that was his brain force behind that. And Chimo Trust, we support charities that already exist and that are already addressing the need to help young people who are suffering from diagnosed mental illnesses, to loneliness, to exclusion from school, and to also really increase that social mobility as well. We have supported 9 charities so far. We've only been going for 18 months, and the charities we support are all around holistic interventions to help those young people, but in a therapeutic, psychologically informed way, but in an unconventional sense. We support 9 charities across the geography of the UK so we can spread the love, and some of the charities we support are just beyond in terms of what they're doing, so innovative. I shouldn't say some, all of them. We're supporting, for instance, charities that have non-contact boxing therapy for young people as a way to learn emotional regulation. We support charities who use horse behaviour, not even horse riding, but horse behaviour to understand emotional health for young people who are really struggling with emotional regulation again and complex mental health issues. We support the Wave Project over in Cornwall, Surf Therapy, and loads of arts and sports and nature-based interventions. And it is just one of the things I'm so passionate about, because I really see us as progressing this space by bringing things back to human connection and back into the community and back to third spaces and anchor organisations where young people can actually go and meet like-minded people and get upskilled as well, whether that's upskilled in terms of a new hobby, but also in learning more around how to cope with their emotions. So I'm deeply passionate about this work, and we've got a wonderful summit next week where we're bringing together all our charities in London as a common meeting point to learn best practice from one another, talk about social prescription referral pathways and how to enhance these referral pathways and how to scale up further. And also we have the Anna Freud Foundation talking about how to really improve upon data collection and enhancing the impact through research and data as well.
Wow.
Yeah, really inspired by this work.
So many knock-on benefits. It sounds like showing the data of the amazing work that these communities have been doing for years. Love the variety of things you mentioned: boxing, art, surfing. Just unbelievable, and gives me so much hope on this social prescribing day, because you know what this really was the vision and dream of health workers like you, who just wanted to do right by their patients, give them another option on the healthcare menu, while they themselves are also members of communities who need connections. There's just so much to be hopeful about.
Of course, I couldn't agree more with that. It's such a disruptive time. There is some good disruption, I'd say, and a lot of hope that we can hold on to. And so just bringing it back to the practitioner and back to purpose, you obviously spoke about Akila and the purpose that volunteering job allowed her to have and how she moved her way up in the organisation. How have you found purpose with the work that you've been doing in this space?
That's a great question, because I think as journalists, we try our best to keep a distance from the topic. You say, we're reporting on this, we could be objective. But as I was listening to stories of people like Akila and Frank over in Sheffield and Nick over in Salford and Amanda over in Devon, you can't help but see the humanity in their stories and see it in your own life. And I think I had this very toxic coping mechanism of trying to push down my own feelings and unwellness. And it was through their stories and through learning about social prescribing that I learned you don't have to be sick, clinically ill to benefit from the connections in your community. You can also go ahead and join your local garden, see what kind of art classes are available near you. Look at what kind of sports teams are on offer, all the things that social prescribing aims to do. I have found so much healing in that myself, which the third part of my book, The Connection Cure, gets into.
And what's the wackiest social prescription activity you've come across in your
Oh,
research?
great question.
Like the nichest, wackiest, just, ooh, I didn't know that was about.
Something, I think it comes back to this comedy on prescription model.
Oh,
that
we love that.
Just what an amazing thing that there could be people, of course, struggling in the most deep sense, depression, anxiety, and that they could find healing in such an age-old form of connecting with other humans through a comedy prescription taught by comedian Angie Belcher. I just love that. It's definitely the one to me that raises the most eyebrows in the best way, because you would just never think about that being something a GP would prescribe.
Completely. And it was such a funny coincidence. Julie and I have been together the whole afternoon, and we were talking about what are our favourite interventions that we've come across. And before I could even really talk about what one of my favourites were, Julia brought up Angie Belcher, which really rang a bell in my head. And I was like thinking, where have I seen that name before? And then I realised I was invited by Rethink Mental Illness last year to their comedy event, which they got around 10 to 15 men who had been sectioned, who had attempts on their life from really suffering from mental illness. And they got them together in a training program with this professional, wonderful comedian, Angie Belcher, to learn how to tell their story through the comedic lens and gain that competence to then go on stage at the Soho Comedy Club in central London and tell their story to a whole audience. And I was blown away. I was laughing with tears. I was laughing just hysterically, but then also crying with tears at some of them. It was so moving, and just the guts that it took these men who had suffered so much and also felt so much stigma to get up on stage and tell their story through comedy. What a brilliant project.
It's so amazing, right?
And so shout out to Rethink and Angie. Seriously.
Absolutely. And it just keeps coming back to this point of healing through your community. These connections exist. Cormac Russell with the asset-based community development framework talks a lot about how our communities are so rich with hubs of connection. I hope on this social prescribing day, people can go out there, talk to their practices about getting a social prescription, and just have a look around at what's already in their community that might exist.
Absolutely. And that is our take home. Be curious, talk to people, connect. Whether that's, let's not demonize phones. Phones can allow us to connect with people, but try and call someone on a walk instead of texting them lying on the sofa. Connect with people and see what's out in your community, and definitely chat to your local primary care practice to see what's on their radar and what you can get involved in. And maybe you've got skills to offer people in your community as well.
Absolutely. That's been another favorite knock-on effect of social prescribing, is often the people who ends up getting these social prescriptions, such as Akila or Frank over up in Sheffield with Ollie Hart. They become some of the most passionate ambassadors of social prescribing, volunteering their time to get more people the support that really helped them.
And that's the most sustainable model. And what I love in mental health, especially within the NHS, is you see that the service user becomes the service provider once they get that through the gates of recovery. And obviously recovery is not a linear process, but they get the strength to say, actually, I want to give back to the community and help others who are in my position a few steps back. So I absolutely love that, and thank you for all the work that you do.
Thank you, Dr. Ali Jaffe, for all the work you do, and all the health workers and community leaders and patients who've become ambassadors. Thank you for making Social Prescribing Day a thing. It's been
absolutely
such a
so glad it's a thing.
Yes.
So glad it's a thing. And don't forget to buy Julia's book, The Connection Cure. It's nearly out. When's it out?
It's nearly out. It's available for pre-order. It'll be on bookshelves in June.
Amazing. And check these out.